45 to 50 million uninsured. There are 45 to 50 million uninsured persons in this country. 15 million who are underinsured, and 5 to 10 million who are fraudulently insured. And I would be happy to discuss that point here. 14,000 people lose their health insurance daily in this country. Middle-income Americans are losing their health insurance faster than high-income individuals. 25,000 people die in this country on an annual basis because of lack of health care insurance. Each uninsured person in this country costs each insured family about $1,000 annually. It's estimated that the economy loses about $130 billion a year due to untreated illness, which is related to lack of health insurance. And it would cost about $125 billion a year to insure all the uninsured. Over 60% of bankruptcies in this country are related to significant health debt. And at any one time, 20% of employed individuals in this country have health care debt. I'm sorry, that's not employed, that's not insured, but employed individuals have some health care debt. The U.S. healthcare system is the most expensive in the world. There are higher administrative overhead costs in this country, far exceeding any other country. In fact, in 2008, $650 billion was spent in excess spending on administrative costs. $150 billion of that in 2008 was spent on insurance company underwriting, marketing, and product development. $150 million that did not go to health care spending directly for care. And remember again, it would cost $125 billion to cover all the uninsured in this country. The U.S. healthcare system is the most expensive, but it's not the best.
Now, first of all, the most important thing you should walk away from is that Medicare, you are guaranteed your benefits, and your benefits are protected under Medicare. Don't listen to anybody that tells you Medicare is being cut or is going away. I get tired of hearing about that, and believe me, it's not true. So please, first and foremost, your Medicare is not going away, it's not being cut, and in many ways, it's going to get one heck of a lot better. Another point, remember that this process, this bill, will enhance the long-term financial health of the Medicare program. According to official estimates, cost savings, such as we've achieved through this act, should keep Medicare financially stable almost a decade longer than if the new law had not been passed. Also, over 10 years, the bill reduces the U.S. deficit by an estimated $143 billion, as estimated by the nonpartisan Congressional Budget Office. We need to set those issues to rest. Now, some important things about this bill for Medicare recipients: it will provide free preventative and wellness benefits that have been added. This includes things which you probably don't want to think about, but colonoscopies. If you've had a colonoscopy recently, as I have, they're very expensive and not a lot of fun either. But it includes those kinds of screenings. It includes annual physicals. All good things that if you take advantage of them, you're much less likely to get sick and need extensive health care. So this is really important, a real important part, and it includes, again, annual physicals. And that'll be effective in 2011. Change, please. Okay. Let's talk about prescription drugs. Unfortunately, has nothing to do with donuts. I wish it did, but it doesn't. The donut hole is when people with Medicare Part D, that's your prescription drug program, when you reach the initial plan limit, which is $2,830. In other words, when you have spent and taken in benefits of $2,830, your benefits stop for a while. Okay? When people when this coverage gap starts, after you have spent the $2,830. That's called the donut hole, or whatever. Donut hole. So, it comes in phases. They're going to close it slowly, 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 but it's going to close. Those of you that reach the initial limit, that's the $2,830, will this year receive a $250 rebate. The donut hole is starting to close. And then by 2020, it will disappear altogether. There will be no gap in coverage of service.
Medicaid expansion. The health reform package expands Medicaid to 133% of federal poverty level. This will take effect in 2014. What does that mean? A family of 3 today, in 2010, that makes $24,352 will be newly insured. There's estimated 16 million persons across the United States that this will affect. And the states will also receive federal matching payments for the cost of services to expand. 100% in 2014, and then the percentages reduce each year until it will be 90% after 2019. I can't tell you what those state amounts will be today or how much this will mean for the state of Kansas, but every state will be affected.
We think that after healthcare reform is fully implemented, we will still have 15,000 to 20,000 people without insurance. They won't qualify for Medicaid, and most won't be able to pay for insurance even with the subsidies in this group. They're likely to be anywhere from 26 to 64. Some might be younger than that who haven't been able to be on their parents' insurance plans. They're likely to be working for small employers because a lot of people in that income range are working for smaller employers. And so they'll be making about $9 to $13 an hour. Figures they'll change by 2014. Next slide, please. All right, so who will be able to afford subsidized premiums with the new health reform legislation? I want to talk about people who are at or below 400% of federal poverty level in this group. That's because those are the only people who will potentially be eligible to purchase insurance with subsidies on an individual basis. Certainly, there are employer credits and etc. But I want to talk about the effect of these subsidies as they will exist for people. On the left-hand side, you can see people up at the top, and I kind of put people up at the top here because they're the ones who can afford insurance. And most of that left-hand side are the people with Medicaid, and these are the folks with the lowest income. The part you can't see on the bottom there shows their hourly wage from $0 on the left, clear going to about $21 an hour on the right. And people who are just a little bit above the Medicaid eligible income guidelines will get subsidies to be able to purchase insurance for about $50 a month. It's based on income, and so the amount varies by income, but those folks will likely be able to purchase insurance. The way the subsidies work for this middle group that's down at the bottom here, they're making between $9 and $13 an hour. They are eligible for subsidies, but their premiums, even with the subsidies, can go up to $180 a month based on their income. And we believe that most of these people will choose not to get insurance. It's going to be cheaper for them to either pay the penalty, or they may not have to pay a penalty because there are income caps for lower income people. And so there's still going to be a considerable group of people that we think won't be able to do that. Here to say today is that, first of all, we need coverage today for everybody in Sedgwick County. I think health reform has helped us to make a step forward in getting coverage for a lot more people in Sedgwick County. And after health reform comes, we are still going to need community support in a variety of ways to serve that 15,000 to 20,000 people group that will not be able to access health care coverage. We are going to continue to need providers who donate. We're going to continue to need programs like Project Access that coordinate donated health care.